I'll just give a anecdote from Alaska when it comes to Medicare and those that are on Medicare, their ability to see a provider. In our state's largest city, half the population of the state, pretty much in the Anchorage area, we've got about 17% of the providers that will take Medicare-eligible individuals. 17%. When we last checked and counted heads in terms of those providers that we could call up and say, are you willing to take new Medicare-eligible individuals? 13 providers in the largest city in the state of Alaska. Now, when we talk about the cuts that are being proposed in this legislation, and you try to figure out, well, what will the impact be on those that are currently having a very, very difficult time in getting in to see somebody who will take Medicare. Those that are worried and anxious now are only more worried and more anxious as they learn that this legislation would be about $500 billion in cuts to Medicare. When I asked the people at a town hall meeting a couple weeks ago, do you really think that if we can cut this much out of Medicare, it's not going to do anything to your access in terms of those that are willing to see Medicare providers? Not one believed that this was not going to have an impact to them. And when we talk about access, if we just provide you with a card that says you now have this insurance, if we haven't figured out how we can ensure that there's somebody there who will see you, we haven't done you any favors whatsoever.